one main thing that is being explored in the clinic is whether a chemotherapy-free treatment approach is feasible in the frontline setting. It is already clear that in the relapsed refractory setting, BRAF inhibition plus anti-CD20 immunotherapy, so like, for example, Vemurafenib plus Rituximab or Vemurafenib plus obinutuzumab is a viable approach, and actually a very useful one in patients that have had multiple relapses after chemotherapy. Now the question is whether, since this regimen, Vemurafenib plus Rituximab, is very effective in the relapsed refractory setting, whether it can be also used in the frontline setting as an alternative, not as a replacement, but as an alternative to chemotherapy with cladribine alone, pentostatin alone, or with Rituximab, because chemotherapy alone or with Rituximab is again a very effective frontline treatment strategy. So it's difficult that it cannot be replaced altogether, but a chemotherapy-free approach with a BRAF inhibitor and an anti-CD20 antibody in the frontline setting, if it is established, like we are trying to do in a randomized trial, if it is established to be as effective but less toxic than the chemotherapy-based standard of care, would give the clinician another option to consider in alternative to purine analog chemotherapy, for example, in patients that are frail or elderly or have an active infection or are deeply pancytopenic and so are at greater risk of developing an infection due to chemotherapy. So this is one main theme that is ongoing in the frontline setting. And in the relapsed refractory setting, we have already a lot of drugs, but many other drugs that have been successfully trialed in other B-cell malignancies, like bispecific antibodies or antibody-drug conjugates against B-cell antigens like CD19, CD79B, or CD22, or CD123, and even CAR T-cells against the same targets that have been already used in other hematological malignancies should be theoretically active in hairy cell leukemia, and it would be very interesting to try them in patients in hairy cell leukemia patients in the relapsed refractory setting.